right, moving on to the head and neck palpatory landmarks. We've been discussing the spinous processes pretty much nonstop. So here they are in the neck, the cervical. The spinous processes are palpable, and one thing about them that you'll notice if you look at a skeleton or in your bone box is that they are actually a lot of times bifid or split. As we come down, when we get to about C7, we come to one that sticks out very far posteriorly. This is referred to as the vertebra prominens, or the most prominent spinous process. Sometimes it's C7, sometimes it's T1, but it is a palpatory landmark you can use to count vertebrae thereafter. The curvature this makes can be more or less pronounced on the different individuals. It is called the cervical lordosis. And as we move upwards, we come to the junction of the atlanto-occipital bones. So the atlas and the occiput meet right here. We go a little further posteriorly up the occipital bone, we come to the external occipital protuberance, a very palpable bump right there. And on the lateral side, we have the very pronounced mastoid process right here, just posterior and inferior to the external opening of the ear. And we'll take a look at some of these on our model in just a second. All right, looking at some of the palpable landmarks of the head and neck, we're going to have you turn around. So as usual, the spinous processes of the vertebra are some of the most easily palpable as you work your way down. You can sometimes actually feel the bifid nature of those guys. Some of them are split. And as you come to the base, you're going to find one that sticks out further than any other. Let's have you face sideways. So here we've got, with the vertebra prominens, this is likely C7, although it can be T1. But if you find two prominent ones right next to each other, you're looking at the C7 and then T1 spinous processes, and that allows you to count the others a little more easily. Now if you notice there's a slight curvature of the cervical vertebra, that's called the cervical lordosis. As we come up here to the very base of the skull, we come to the atlanto-occipital junction, where the atlas and the occiput meet. Now what happens at the OA, or the occipital-atlantal junction, is movement up and down. So if you will just nod your head yes, and there we go. OA is yes. A little further down between the atlas and the axis, we have the no joint. That's where you have a lot of cervical rotation. Very good. So here we move up a little bit further, and on the back of the skull, usually covered by hair, but easily palpable, is the external occipital protuberance. Nice seg for muscle attachment right there. And we come down just posterior and inferior to the opening of the ear. We have the mastoid process right there. And that's an attachment point for the sternocleidomastoid muscle, which is the muscle going transversely or diagonally down the neck. And just posterior to that, we've got the trapezius muscle. Go ahead and turn back to the camera. The trapezius muscle is what makes this diagonal arch across the back right there. Comes down here to the spinal scapula and then continues down diagonally this way. The most palpable spot for it is located right there. All right, moving from the mastoid process right here, we're going to come to the jaw. Now just anterior to the jaw, so we have the TMJ, the temporomandibular joint, where the jaw articulates with the skull, the temporal bone. Then we come down the jaw, we get to this little curve right here. Not surprising, this is known as the angle of the mandible. And right out here in front, this protuberance is called a mental protuberance. Very tip of the chin right there. Now, we come up a little bit here. This strata bone is called the zygomatic arch. As we take this across the front, we get to the supraorbital margin, just on the upper part of the orbit right here. And then down the very front, a lot of our nose is made of cartilage, most of the area right here, but right here we have two nasal bones on the very far front right there. Now as we look a little further down, the hyoid bone is one of the bones of the neck. We can't really see it too easily here, unless we do a quick cervical adjustment to our pal. Don't do that with your partners. And right here, the hyoid bone forms a little horseshoe-shaped structure just anterior to the cervical vertebra, right there. And just inferior to this is where we have the laryngeal cartilages, and those are not represented on here since they are soft tissue. We'll take a look at some of these on Ashley. So moving from the mastoid process just behind the ear, anterior to it is where we find the TMJ, temporomandibular joint. If you want to find that, just have your partner gently open and close you'll be able to feel the condyle rotating in right there. Good, thank you. So that's the temporomandibular joint. Right here is the angle of the mandible where it makes its little turn. And then right in front is the mental protuberance, point of the chin, right there. Coming across the front, we have, extending from the upper part of the ear towards the orbit, the zygomatic arch, right here. Go ahead and face forward. So the zygomatic arch is the cheekbone, laterally. And coming across the top, we have the supraorbital margin, making up the upper part of the orbit. And coming down across the front, we've got the nasal bone and nasal cartilage. Remember, cartilage moves, nasal bones break, so be very gentle as you manipulate those small bones. Now, if you have your partner look up, you can palpate the hyoid bone. Hyoid bone is very delicate, so don't grab them by the throat and start throttling. Instead, just kind of palpate and feel for anything that's sort of giving you a little resistance right there. Hyoid bone coming across the front. You can feel it on the left and the right. And then just inferior to that is where you find the laryngeal cartilages, the thyroid, the cricoid, and so on. And these are the things that in males are going to be more pronounced, as you have the Adam's apple, thyroid cartilage, but everybody's got one and you can palpate it, just working your way down. As usual, when you're working with the throat, gentle is good. And that takes us to the end of the palpatory landmarks. Good luck in clin skills and OPP. We'll see you in anatomy very shortly.